We do have another unfortunate situation of a positive case here in New South Wales that came in after the 8 p.m. deadline last night. A 45-year-old gentleman who had symptoms on Saturday was tested yesterday, being Tuesday, and just after 7 a.m. this morning, a positive result from his test was given. Obviously, there'll be more work to do. This is very preliminary advice to the community on the basis that New South Wales Health and the government has always shared all information with our community as soon as possible. But we do still have to do, if you like, checks just to make sure that it is a valid positive case. Indications at this stage are that it is. But as we're well aware, there can be shedding of the virus for months after someone's had it. So we're doing those checks. This gentleman drives vans carrying international and other aircrew back and forth to the airport. So the concern, of course, is that it highlights what I was talking about last week when I said that the New South Wales government's focus as the virus seemed to be contained in terms of community transmission. Our most exposed areas included, or principally around our borders. Obviously, we may be an island, but we are not totally isolated from the pandemic that is raging across the world. International air crews are vital for New South Wales and indeed Australia. They are bringing in our freight, and of course they're bringing back our Aussies. So we need to be cognisant of the need to work with the airlines to try and ensure that their air crew are able to come into the country, into New South Wales and into Australia, but also to make sure that they do it in a safe way, a way that keeps our New South Wales community safe and preferably away from the possibility of this virus. It's particularly challenging for New South Wales because we have somewhere between 2,000 and 3,000 aircrew coming in internationally every week. There's no doubt that would far exceed the numbers in any other state or territory. It's fair to say New South Wales continues to shoulder the challenge of bringing in people from overseas, that is Aussies, but also bringing in freight. So we are now going to have to look more extensively at some of these issues that were briefly mentioned, I understand, last week at National Cabinet following my comments in a public place last week to you and to others last week. Where do we go from here? Well, middle of last week, I had a discussion along with senior health officials with a number of international airline representatives. We canvassed with them the fact that New South Wales Health and the government here, me particularly as Health Minister, were very concerned about the possibility of the virus coming in with international aircrew. You'd remember that we had the 66-year-old lady at the Ibis and the Novotel 2 weeks ago, and that would appear on the basis of the genomic sequencing to have been most likely to have been connected with a US aircrew, as the genomic sequencing showed the top matches across the world were actually from the US. So we were discussing what further steps we could take that would work for the airlines but work for our New South Wales community, and indeed which would perhaps set the basis for the broader issues across Australia and to be discussed then at National Cabinet. I think this case now drives home the urgency of those issues that were highlighted and foreseen by us here in New South Wales. I've spoken quickly to the majority of ministers in the country and just indicated, that is this morning, and just indicated that I'd be making this comment today and just indicating that we all need to be looking at this. And as the other states step up, hopefully, to have more international flights they will also hopefully be able to implement a regime that we can all agree on. But if not, then New South Wales will certainly be making sure that we do everything we can to keep people safe. At this point, we will actually be implementing more discussions probably within the next 48 hours with the international airlines. But the inclination that the New South Wales government has at the present time is to say to international air crews and airlines that international air crews coming into New South Wales will be most likely to be required to quarantine in the same way as any other international visitors or returnees, Australians returning to Australia. The difference would be, the difference would be, of course, that they would be in a quarantine environment, but not necessarily for the full 14 days, because they obviously have usually turnarounds between 24 and 72 hours. We have a good quarantine system where police look after the hotels. We obviously have our health hotels too for other categories of people who need that additional health assistance and for positive COVID cases. But that's what we're looking at the moment. And we'll have those discussions with the international airlines, as I said, in the next 24, 48 hours. I'm going to ask Dr. Chant to add to anything that she wishes to say on any other issue or this issue, and then we're happy to take questions. Dr. Chant.
Thank you, Minister. So just in summary, the usual contact tracing is occurring. The highest priority is the household, and the household contacts have been tested. Results are pending. That will confirm and assist us with understanding how recent the infection is, as well as other serological tests. The genome sequencing is being expedited because, as we always keep an open mind whilst we have a plausible hypothesis that this transmission may have eventuated from contact to international flight crew. It is always important to remain open in these investigations. We will be updating you with further information, but the advice we have at hand is that air crew were the people that this gentleman were transporting. So it is an issue for the general community who may be concerned that they've been on a bus or a transport or a minivan. But we will obviously update you as you're aware information changes, but we will update that later in the day. Thank you.
Is he working for hotel quarantine transfers, or does he work also in the general community generally for taxi services?
No, he doesn't work for taxi services. He works for Sydney Ground Transport in Alexandria, and I just want to very much acknowledge the assistance of that company in providing us with the details of his movements, and also to confirm that he reports wearing masks and taking precautions. So again, it's very important that we don't draw conclusions or make suppositions in these cases.
But did he carry the general public?
No. So Aircrew, his sole responsibility was transporting aircrew. As I said, I'll update you, but that's the information that we've got both from the individual and the company. But as you know, if new information emerges, but at the moment, I'm stressing that because I don't want the general community to think that they could have been exposed.
How many in the household, and has he gone anywhere else? Has he gone to the shops? Are there warnings on other places?
Obviously, we'll update that, but our preliminary information is that clearly we will be looking at the trips that the people that he's escorted in those transfers between the airport and hotels. But again, his contact in those settings was to basically help people out with their baggage and help them exit the minivan or buses. Also, he has three household contacts, and they've been tested, and we're expecting results probably in the next hour or so.
Do you know when he last was on the job picking up flight crew?
Look, I don't know that for certain. I know that he did have symptom onset on Saturday and did work again for a few shifts subsequent to that, and then got tested yesterday, and we've got those results through at 7 a.m.
What area do we have to sort of be concerned about there in terms of his general movements around the community?
Look, at the moment we don't have very many movements that he's had. Obviously, we're re-interviewing to get that. We will be identifying one community sporting site that he did go, but again, I just want to make sure we've confirmed the details of that and contacted that before naming it publicly.
So any connection at all with Novotel?
No, not. I mean, as I said, we haven't at this point got the information from the company to know where he dropped it off. But again, that's another avenue for exploration. But at this point in time,
Clearly, we've got a problem because it's, and the Minister has mentioned this quite often. Is there, firstly, do we need to look at contact between driver and the crew? And then also, as you rightfully say, the Minister just said, quarantine. These people are sort of being isolated haphazardly, it sounds. You know, they're not as strict as a returned traveller. So do you want them locked away in quarantine in a hotel whilst they're in this country and before they get on the next flight out of here?
So I think the Minister's articulated the issues that we've got to cover, and I think I really strongly support us engaging with the airlines about how we can really strengthen the system. We recognise the threat is growing overseas with the increasing numbers, and it is important that we have recognised the risk that returning travellers and also our aircrew and our ports present. And this is part of the work that's been progressively done to strengthen those. We have been doing audits of the facilities that the flight crew have been staying in. We've also been, as the Minister said, had a meeting with the airlines to stress the importance of some of these measures. So we will, as the Minister said, indicated his inclination to strengthen the quarantine, and I certainly support that we need to do more work in this area. And we will be engaging with the industry very shortly with how we can strengthen it.
How many flight crew have tested positive over this period, and is New South Wales or Australia notified if they then fly home and test positive in the United States, United Kingdom? Are we then notified that they've been here while infectious?
Only if it would be under the international conventions where they were thought to be positive, but also we know that many people... I should say that a number of the airlines have actually put in rigorous programs, and so one of the issues for us is not all airlines are the same, and it is important that we strike that balance. But clearly, COVID is a very transmissible virus, and it is also unpredictable in the sense that sometimes we have seen on transmission and in other cases not. We know how to protect ourselves, and it is about that diligence with PPE, that social distancing, making sure you've got the appropriate cleaning in place. And I think that we need to work very hard at both in our quarantine hotels but also with those settings caring for our flight crew to make sure those same standards are applied.
There are a number of people that come into contact either directly or indirectly with these return travellers and these aircrew. Could we go a step further in making mandatory testing for a broader spectrum of people as opposed to just those that work at the hotels directly?
So we are, with the advent of our salivary testing that's been developed, I mean, clearly you probably would have acknowledged I shouldn't at all express some concern about the pain or discomfort associated with nasopharyngeal swabbing, but you can imagine that if you were required to do that on a very regular basis, that may cause you anxiety and also, causes nosebleeds and actually does cause some irritation. So we have developed a salivary test which gives us greater operational flexibility for surveillance purposes. At this time, we're not using that for diagnostic testing because its performance is slightly less. But as our techniques become more valid, we may see the emergence of salivary testing more uniformly. So we are testing at the moment in our airports, in our police quarantine hotels. We are testing security guards on a daily basis, and we're extending that to cleaners. And we have also been conducting a pilot at the airport with salivary testing for returning crew. I should stress that this is not a silver bullet. So as you know, and I've stood up here every time, just because you've had a test today doesn't mean that you are not infectious in the afternoon. And I think it shows this is highlighted clearly by a New Zealand case where my understanding of the case is that they were actually screened in the morning and probably became infectious sometime either that evening or the next day and developed symptoms and then went presented for testing. And so, like all things, it's a complex system. We need to make sure we control all of those contacts. We need to make sure we have the appropriate personal protective equipment worn, and testing can play a role, but no one piece can protect us.
What would, Minister, in terms of just getting a little bit tougher on the airlines, what would you like to see?
I don't think it's a case of getting tougher. We need the airlines to come to Australia.
Sure.
They're bringing our Aussies back. They're also bringing in our freight. What we need, though, to do is recognise that there's a high variability in the approaches the airlines take themselves in testing and looking after their crews. There are challenges for us because some of the airlines come in quite relatively irregularly, others come in very regularly. We need to work with them and understand the protocols they have in place, but also make sure at the end of the day that those protocols work for us. My job, our job, the government, the New South Wales government's job is to protect New South Wales, and indeed I think it's fair to say with the borders gone, each state and territory are looking to protect all of Australia. So we need to just work with them. But I think one of the issues at the moment is that some of the crews are actually in quarantine hotels, but the same level of application to keeping them appropriately away from others is not the same as we deal with people who actually are there for quarantine, international travellers.
So they have a free run, or not?
No, they don't have a free run, but they have obviously one of the issues for the airlines is that their crews, as was put to me last week in that meeting, some of their crews might be effectively going from one country to another and effectively almost quarantined, certainly not able to access, for example, going out for a run or a walk, and they're talking to us about the implications for their mental health, for the flight crew. It's quite complex, very complex. Others, we don't know what they actually do in their home countries. They don't necessarily share all that information with us. So we just need to work through with them and try and come up with a system that works for our state and our country without necessarily, causing grief for the mental health and for the airlines themselves. It's a challenge.
Could it backfire on you though? Because we need
lots of things can
airlines.
backfire on me.
Hopefully not, but we need these airlines to bring Australians home.
Yeah.
But we make it too difficult for them. The airlines will say, "Well, we're not going to do it."
Well, look, that's the challenge, isn't it? Because as I think you all know, and as Dr. Chancellor said, this COVID virus is a very challenging virus, and everything that brings up is a very new challenge for everybody. No playbook. So, and that applies to the airlines coming into our country, which at this point is one of probably the 4 safest countries in the world to be in. So we're trying to make sure that we strike the balance, which is why we'll have those discussions again with them off the back of this particular case. We obviously, I'm not sure whether Dr. Champ mentioned this, but obviously there's genomic sequencing being done on the case, and we'll know within 24 to 48 hours. As to confirmation that it is from an international source. We'd like to understand that a little better. But even if it wasn't, which we're expecting it will be, we still need to do more to try and tighten up and just make sure the international crews are not getting avenues available to them to make sure, or to enable the virus to get out and to get amongst our community. Clearly, there are people. Sorry, guys. Clearly, there are people working in the hotels, the cleaners, the security, the housekeepers, food providers that are our locals. So we need to make sure that we are doing everything possible to protect them, so they aren't the portal for the virus to enter our community.
So what freedoms are?
Sorry, Ursula
freedoms
first.
Are these aircrew getting now that they won't be getting in the future? Are they being let out?
I think it's. No, they're generally within the hotel, but it's more about some of the protocols that apply to them in, as we saw last week or the week before. There's clearly, it's a two-way street. It's what they do, but also what the staff of the hotels do. So if the staff in the hotels who normally do the cleaning are not are wearing the appropriate PPE and treating it preemptively as if they are a quarantined person. That could be an issue. We just need to look at all these issues. It's not easy. I just remind everybody that while we're making this announcement, this gentleman was only proved positive this morning at 7 a.m, so at 4 hours. And Dr. Chant perhaps understated the fact that if I asked any one of the community, any one of you, where you were in the last 5 days and what your history was, doctors experience this all the time, trying to know what have they been doing, where have they been. It's just an issue that we've got to give health some time to work through this and let our tracing team and others work through with the transport company and the airlines and just do their work. Sorry.
Dr. Chant, one for you. I was just wondering, obviously when we had that case, I think it was 2 weeks ago now, the Novotel case, New South Wales held its breath wondering whether there would be a new outbreak, and as so far there has not been. Are you confident that the system will be able to do the same for this case?
I'm confident we've built a robust sort of contact tracing system. We've got great testing capacity. We work as a system and we work across government. So for me, the fact that we've got from a call at 7 o'clock to all of the information, to family members being contacted, to retesting, to specimens transported to Westmead for genome sequencing in the space of 4 hours is actually a positive and reassuring story. The problem is COVID doesn't have a playbook, and so we've held our breath when we've had taxi drivers and they haven't managed to transmit. We've had other people that have been transmitted. Now, we know some of the context for that. We know that very much indoor settings. But again, even in those contexts, we've known that some people have not managed to transmit and others have. What we need to acknowledge is the person came forward for testing, and that is great.
But he had symptoms, did he?
He did have symptoms and he came forward for testing. So I wanted to say thank you, and we need to have the community continue to do so.
And Dr. Chant, sorry, you may have said, was he wearing a mask through these trips?
Yes, he was wearing a mask. Obviously we need to verify that, but that is the reports that we have, that there was a attentiveness, and that was verified from a couple of different sources, that he was wearing masks.
And what about the how many trips he took between Saturday and...
We'll be able to release that information shortly. It's just being provided by the company.
Final question, guys. I mean, what is the work they look for a guy like this? Doesn't he wear like hazmat suit or something like that? A mask is enough if you're travelling with people from overseas in the back?
In theory, look, Dr. Chan, I've said this 1,000 times, that people at the front line, no matter where you are expected to wear certain personal protective equipment, particularly masks. But also, people are people. Do we know that he always had it on? Do we know that someone, he didn't open a door or touch a door handle, open the door for the people after they put their hands on? This has been going on for 10 months, Look, can I just say this finally? I think whilst we are letting the community know, because we've always been upfront with our community and we want our community to know, we should also keep this in perspective. 3,000 people died almost every day in the US in the last week or two, and many more before that. So 3,000 people died. We have one positive case at the moment in New South Wales and therefore Australia. We will do what we need to do, which is to make sure the message gets out. It's not a case of, you can't expect in a COVID world pandemic that we won't from time to time have a case. It will happen. We've been saying that for months. It will happen. But what we will do is we will now try and address the issues and make sure that our learnings are shared with our colleagues across the country. But I would say this to the community, the best Christmas gift you can give to your family, your friends and your community is to go and get tested if you have any symptoms of a virus, and do it straight away. Do it straight away.
Minister, one more
Yes,
question. The other health, you said you spoke to the other health ministers
Yeah.
across the country. Have
Most
any of them expressed concern? WA, Queensland, we know, had very strong border policies. Are we worried about any of the borders coming back?
No, I'm not. Oh, no. I just, a matter of courtesy, because I think all the state and territory health ministers work extremely well. All the health ministers work extremely well together. It's just a matter of letting them know to be aware of what the issue is, particularly because international airlines are picking up in terms of flight numbers into other states. We're wanting them to pick up far faster, of course, from a New South Wales perspective, so we don't have to take so many. but that means that we should all share the learnings and share what goes on. So
No,
it really is a very good relationship, I have to say, between all state and territory health ministers and the federal minister, and we just need to share that information. That was all it was.
No one expressed concern about us?
No, they were all supportive. Yeah, no, fine. Thank you, guys. Thank you very much. Appreciate that again. Thank you. Thank you.